Hello, Namaste. I'm Dr. Kartik, consultant surgical gastro and liver transplant surgeon here at hospital. So today, as you all know, it is the World Liver Day. 19th April celebrates World Liver Day to spread awareness about a very important organ that we all have. That's the liver. So as you all know, that liver is a very important organ for our health and happiness. And if the liver is having some issues, then it becomes very difficult for a human being to survive his life. So what are the different functions that a liver performs? So liver has many functions, including synthesis of protein, synthesis of clotting factors, detoxifications of the toxins in the body. So when our liver gets affected, it affects our general lifestyle, our health, and it leads to severe complications which can be managed in a big hospital and only, leading to a lot of cost involved to the patient. So what are the steps that we should take to keep our liver healthy? First and foremost, we should make sure that we eat healthy diet. Healthy diet means we should not take much fatty food. We should take a balanced diet, including more of proteins, less of carbohydrates. Daily exercises are a must because that will help us reduce our fatty liver. And make sure that you eat all the healthy foods only and not adulterated food items. And the most important thing is not to consume alcohol. So alcohol is one substance which causes a lot of damage to the liver. So if your liver gets damaged by alcohol, it sometimes becomes irreversible. The reversible damage to the liver is known as cirrhosis or chronic liver disease. The treatment of which is very complicated. It involves a lot of cost and resources to the patient. So once a liver sets in for cirrhosis or a chronic liver disease, the only treatment option that is remaining for us is the liver transplant surgery, which is again a very expensive treatment. So we should make sure that our liver is always in a healthy state. And to make sure that, as I told earlier, you have to eat healthy food, make sure that you exercise daily, and make sure you give all the healthy diet to the liver. What are the symptoms of liver disease? So when the liver is having problems, as I told, the functions of liver, when such disease affects the liver, all these functions are decreased. So one of the most common symptoms that happens is the patient will have vomiting of blood, because the blood vessels in the area of the stomach and the food pipe, they get dilated and they rupture and cause bleeding. Other thing is that the patient will have fluid in the abdomen. He will have edema in the feet and face and everywhere. And again, the general health will decrease. Then in the later stages, jaundice will come because the liver will not be able to detoxify the blood properly, and patients will have jaundice, which will lead to further complication like decrease in the mental orientation. And finally, in the final stages of liver cirrhosis, patient will have severe episodes of vomiting of blood, and his kidneys will stop functioning, and this will cause further problems to the patient. So when such symptoms start, whenever you feel that you have some liver disease, your bilirubin is increasing, and liver enzymes like SGOT, SGPT is increasing, you should immediately consult a doctor at the earliest. Thank you.